Hello, Culture Matters podcast. Boy, am I excited for this episode today. Just for this episode, the surest way to corrupt a youth is to instruct him to hold in higher esteem those who think alike and those who think differently. Friedrich Nietzsche. Our guest today, staple in the Culture Matters podcast, advisor to both high performing people and those that dream of high performance, health, spirit, emotion, the mental fitness. Dr. David Yerkes is back to educate us and inform us and help us think differently as it relates to work life balance, work life. He's a podcast host, daring greatly, exploring the dreams and the struggles alike, the adversity in greatness of his guests. And okay, that's enough. Welcome to the show.
Thank you for having me again. I'm really excited. It feels like it's been a little while. We haven't we haven't necessarily had one of these in a little bit, so I'm excited. We have some things I think it sounds like to hash out.
Ha, yeah. So let's start with that. Actually, that's a great idea. We have a well. First, there was a thought that was out there that said, "quote I can't live like this anymore." End quote. Next day, does the same sh. So Dr. David said, "Why do you think?" This is a great question. We can unpack it a little bit. Why do you think people do that? Is it because the discomfort or inconvenience of change is greater than the discomfort of staying the same? People don't like the consequences that come as a result of a lack of discipline, but fail to institute the discipline required to avoid the consequence. That's a really powerful thought that you share on Threads. If anyone's listening to this, follow Dr. David Yerkes on Threads, just your name, what I just said. But I'm curious, what can you unpack that a bit? Because that's a really deep thought.
Well, I think there's it's very common in the human experience to have end up in a place where you're uncomfortable, you don't want to be there, you'd rather be somewhere else as far as like your state of life or whatever. That could apply to health. Of course, that's where my bias is, but it could be business, it could be personal relationships, whatever. And it's not somewhere where you want to be, but in order to get to the place you want to be, that requires some type of discipline, whether it's planning, whether it's um, keeping to a schedule, whether it's tracking your food intake or getting to the gym or whatever. It could be the discipline of of implementing a better culture in your business, something that requires you to go outside your comfort zone and implement some type of discipline. But the ease of staying the same, the ease of staying in your comfort zone outweighs the discomfort of being where you are. And as long as that balance is in that state, then change doesn't occur. So I think either people have that, and this we see this a lot of times. In the hospital, people end up in the hospital, and then they maybe have a heart attack, and then they change their diet, or something they have a bad outcome, or somebody in their family has a bad outcome. So there's this great uh, challenge to them to change what they're doing and to implement that discipline in their life. But prior to that, that
Mm.
that what that stimulus, that's the word I was looking for. That stimulus isn't there necessarily because we're living our lives, we're busy, we're in, a lot of times in reaction mode, as I mentioned in another post. We're living in reaction, in survival mode, instead of attacking life with intention. Um, and so I think, anyways, that's what that quote was about.
What would you say well, would you say that those that you've come across in those near death experiences have a higher likelihood to change?
I think yes, the data I think shows that out as well. I think people commonly, you might call it a wake up call, what
Hmm.
have you, but definitely are more likely to change their lifestyle for the better when that happens. And again, it's not just with health, it's with many other things.
Hmm. It makes me think of the relationship between like the mentor and the mentee. Maybe it's like a soft version of a calamity. Like there's
Yeah.
some type of external accountability
Yes.
one way or another. Like, um, honey, don't drink and drive. Nah, yeah, yeah, I'll be fine. And then, but maybe if
Yes.
someone's already been through that, I'm curious what comes to mind on that thought. Like the mentee mentor relationship is like a subtle, like the principle is the same. It's external accountability. It's less harsh
Well,
than the actual.
you can help me with this quote. There's a quote about that, and it's something about a normal person learns from a unintelligent person learns doesn't learn from their anybody's experience. They don't learn. A normal person learns from their own experiences, and then a wise person learns from others' experiences. So
Yeah,
I
yeah.
think you're hinting toward the wise, hopefully the wise mentee who learns from the wise mentor, and is hopefully able to avoid some of those calamities that they would have had to learn through their own experience,
I got
which
a
is the
quote
most
I'll read
powerful
you.
teacher.
What about this quote? Uh, he who has a why to live. I can't. I'm reading it terribly. Sorry. He who has a why to live for can bear almost anyhow.
Yeah, that's another good one. Yeah. I think that is well, that's a reflection of motivation, our human motivations, and what, how powerful motivation can be if we really truly, for instance, and family, children can be a big one. Sometimes patriotism is for some people. Um, but yeah, we've seen that in human beings throughout history do extraordinary things for extraordinary reasons. Um, I think that's what that is trying to say. But yeah, I
Do
think
you
there
think that there's a connection with you seeing people, constantly in the hospital? Maybe it's like almost like something could have been done sooner. That thought arises like where your passion comes to helping people
well
before you even go there.
that's exactly that's exactly where it comes from. That's the exact thought that I kept having over and over again is
Wow.
how this is so preventable. How can we do something differently to prevent this? And then, my mind always kind of tries to go to the root cause, like, well, but why? What is the why? Like, why is this happening? Why are we not doing it? People know in general kind of what to do, but why is it not happening? And that's where kind of my research really started,
Mm.
is to try to figure out the motivators, and also it wasn't just the fact that people change after an event. Some people don't change at all. And so that was something that was really stressful for me, because it's frustrating to see that. And then also you see people, I had a young man uh, the other day, in fact, and I was trying to tell him the future, basically like, hey, if you don't change this, you're going to be on dialysis, but you can avoid it. And he wasn't really interested in hearing me, but I'm like, I can see your future because I've seen it. And those are the situations that are a little bit frustrating. There's tactics, there's motivational interviewing and coaching and things like that, but if ultimately people have to be willing to give up. People have to be willing to give up some of what they're used to doing in order to change, and change is uncomfortable.
Hmm. When you
So
were um when you were a kid, did you have like pictures around your bed of hospital paraphernalia?
no, I never it dreamed.
The white coat and the what is that? The stethoscope? Is that what that is?
No, I that wasn't like a lifelong dream for me. In fact, I don't think I would have even thought that was possible. I didn't know any doctors growing up. I was a first generation college grad, and I didn't know what I wanted to do. My dad said we need to get an education is basically the gist of it, and he wanted us to be educated so we could hopefully have a better life than what he was able to have. And um, I was able to choose that. I was good at math and science, and when I was getting close to college, I wasn't sure, so I chose pre-med. I remember asking my organic chemistry teacher, "Do you think I'm smart enough to be a doctor?" Like, I don't know. Like, you see these people come through here. Can I make it? Can I do it? And she said, "I don't know." So that was, but being me, I just kept going. I just,
Wow.
well, I'll keep going. Just put one front in front of the other, and I think we talked on another podcast. It's just kind of my that's the way I operate, and
Hmm.
so I just keep going, and and it worked. So that's why I'm here. And I like people. I wanted one of the drivers was I do actually genuinely care about people, and uh I enjoy interacting with people, and I am blessed to be able to do what I do. And the other, one of the other factors for choosing it was, economics.
Hmm.
It's got good it's a good job. It's a good career to have. So I was fortunate to be in a position that all of those things kind of aligned, and I got into medical school and was able to be successful there. And that was something that just worked out for me. But I didn't know if it was going to work out or not. It wasn't a childhood dream or anything. It was just something that I just kind of took it one day at a time, one step at a time, and it happened.
What do you think the motivation or yeah, motivation your pops wanted you to go to school? Like if no one had done it.
Well, I think he grew up he grew up not wealthy, and very, very hard worker, extremely hard worker, but wanted better for us, and that was at the time when I was growing up in the 80s, in the 90s, that was the route to be, have a good life and be successful, was to go to college. Now there's all kinds of, there was pre-internet. The internet didn't really hardly exist. It was dial-up internet when I was in high school. I mean, there were no real internet businesses and that kind of thing like there is today. So
Hmm.
it was still college was the way to go at that time.
And what was his work?
So he worked at General Motors when I was young, and then kept getting laid off, and the economic cycle and all that stuff. And so eventually he decided that was too difficult to keep trying to draw unemployment and then live on whatever that was. And so he took a job driving a truck. So he drove a tractor trailer for many years, and then put himself through tech school to do HVAC, so heating and cooling, and then started a business doing that when I was in high school. I was about, I think, a junior in high school when he started that. And his partner was very um, business minded, and they did pretty well. They made more money than we've ever made. It wasn't a lot. It wasn't like millions. It was, maybe 100,000, but that was more money than we'd ever seen. And so we were able to get out of debt a little bit and live a little bit more comfortably. But that was and he still owns a heating and cooling business today. He runs that by himself, and just pretty much he scaled up to having some employees for a while, but He's he scaled down from that to, he's I think he's 70, just
Hmm.
turned 70, I think. So yeah, he still does. I mean, I'll call him and he'll be out there hanging ductwork by himself. So he still does it all. He chooses not to have employees now. Just kind of keeps it small.
Wow.
And that's what I did growing up. I mean, I've been in all kinds of attics and crawl spaces. I've had more spider webs in my face, summers and blown in insulation where you come out of the attic all covered in sweat with blown in insulation. You look like you've been tarred and feathered.
Were you attracted to entrepreneurship then?
I think I've always been attracted. Somebody was asking me, "What's your entrepreneurial journey?" And I never thought of it that way. It never was something that I didn't even know what that was. But when I was young, we used to ride around the streets of Detroit and pick up bottles and turn them in. We would turn them into the store for for cash, and then we would buy baseball cards and then kind of flip baseball cards or keep them and hold them and that kind of thing. So that was probably the very first entre. And then we would shovel driveways. So when it would snow, we would go around door to door and we would shovel driveways. And uh, we would sell, when I got a little older, we would sell donuts door to door. We did all kinds of stuff to just make a little bit of money and raise money and that kind of thing. I've done so many different little things I guess as a young entrepreneur that I didn't even realize
Hmm.
was till I started really thinking about it that way. And then I bought some real estate when I was in college, some rental property. And that was really kind of when I started seeing myself as more of an entrepreneur and an investor and that kind of thing. But
How did,
that was actually, I would feel like, influenced strongly by my one of my teachers, one of my mentors in high school, was kind of taught us about entrepreneurship and about being a business owner and how to manage money better and all those different things that a lot of people don't get exposed to. So that was a big thing in my life. That was a huge influence in my life.
what did you learn from the investing in real estate?
A lot of expensive lessons. I know I did a lot of things wrong. One of the things I learned was don't like, how do I describe this? I learned a couple different things. One of the big lessons was sometimes doing the right thing, what you believe is right morally, can hurt you financially, and you have to be able to balance that. And so, for instance, we were struggling to make payments. We bought a big group of property in a bad location, and it was not doing well. And I it cost me years of my life
Wow.
to work extra and just to try to make those payments and pay it down. And instead of, I had multiple people tell me, "Oh, just let it go to bankruptcy," but I didn't feel right about that. Uh, for that particular situation, it doesn't mean all people that file bankrupt, businesses start and fail all the time. But for me, in that particular situation, I didn't feel right about it. So I didn't. And um, and then later, the bank president came to me later and said, "Hey, I really respect you for doing what you did." And he knew, I mean, he knew about it. And I didn't, I didn't do it for that reason, but it was kind of affirmation a little bit to see that, people do notice your values and your morals and the things that you do. Just, I've always lived kind of like with that mantra of just do the right thing and it'll work out. And it did work out. And maybe I was wrong. Maybe I should have filed bankruptcy and invested my money and I'd be better off today. But I feel like at the end of the day, I have to, for any time I make a decision where usually the right decision is harder, it's the hard thing almost, it seems like.
Hmm.
If I feel like if I do the right thing, that's the most important thing because still have to live with myself and I have to live with the knowledge of making those decisions and making those choices. So that's probably the number one thing I learned. I also learned, a lot of just technical things about who to hire, who not to hire, how to hire, when to hire, how to do contractors and how to deal with them, how to deal with managers and property managers, had to fire a couple property managers and all those kind of technical things that you learn throughout just from growth, that I've had to learn. And so that's one of the how to deal with tenants, all those things. But yeah, that's boring.
Hmm.
The biggest
Um,
life lesson I learned was, I think, do the right thing. It'll work out.
what about building a team? What have you learned the last 2 years, 3 years?
I think building a team is one of the most important things. It's probably might be the most important thing. And that actually I kind of learned a little bit with the real estate is that's when I was investing in real estate and I was trying to do a lot of things myself because I could. And that's a huge lesson for an entrepreneur. That's probably was one of my biggest lessons as an entrepreneur is just because you can doesn't mean you should. And so it's, you know, as a leader in a say you're a startup or a small company or even a large company, you there may be things that you can do, but maybe it's better to find somebody that's good at that thing. That's their thing and manage that person or lead that person and allow yourself to be the leader and let them be an expert at what they're an expert at. And for me, that was hard. I continued to fail at that at times in my, in my other businesses early on. And I'm starting to be able to recognize areas where I can do that and be better at that. So
Hmm.
building a team for me is pivotal now as I am growing my company and trying to scale it. That's one of the most important things that I've focused on is building a team and identifying those individuals.
If you were trying to ruin um, a really successful hospital,
Mm,
where would you start?
mm. I would start by uh, increasing nursing staffing ratios, trying to cut cost by making nurses see more patients. And that seems to be the number one thing that everybody wants to do. And it is a huge mistake, in my opinion. Nursing care is the most important factor in quality care in a hospital, period. And one of the biggest factors that affects the quality of nursing care is how many patients they have assigned to them during their shift. So, um, I'm a big advocate for nurses. I think nurses are very altruistic in general. They're there to serve and they do amazing things for patients. And if I were going to ruin a culture in a hospital, I would start by undercutting the nurses, not paying them what they're worth, increasing their staffing ratios, all the different things that and here's the thing, healthcare workers can tolerate a lot. They're some of the most tolerant people
Oh, that's
for
interesting.
and so if you there's a buffer essentially. It creates a buffer there for bad decisions. And so you
Yeah,
can
that makes sense.
yeah. So
Psychological.
yes. And so eventually once you start by the time you start seeing the negative impact or the negative results, it's too late. Like I've seen multiple hospitals in the region fail because of this. Jewish Hospital was one of the greatest hospitals in the country. First artificial heart transplant, one of the first hand transplants, I believe, and completely failed culture. And one of the things that I know that they did was just overwork people. They took advantage of people's altruism and work ethic, um, and that was I
Just
believe
an, as
this
an
is my
observer,
opinion. By the
or go
way,
ahead. Sorry.
this is my opinion. I don't want to say anything that's going to cause people to you know come after me, but in, in my opinion, one of the biggest things that and you can see it, you can see into the people that work there and the physicians and the nurses and everybody and the patients. When patients would come to me after being in different regional hospitals, um, they would describe their experience there, and I could see this is clearly a result of certain policy changes, if you will.
Um, I'm curious about this. Let's say that we pay less to the nurse, and that they're seeing more people. So like maybe like I'm gonna give you a scenario. Like how long is a shift?
12
Like
hours,
a normal one? 12?
12. Unless you work in some type of some nurses may work different shifts. Some nurses may work 8-hour shifts if they work in an office or if they work in a surgical suite or something like that. But floor nurses work 12 hours.
So let's say it's 12. There's only going to be a certain amount of interactions in that 12 hours.
Hmm.
And if you're saying more patients, right? So there's got to be like a Goldilocks of at some point quality and quantity. There's got to be like a Goldilocks where it makes me think like there'd have to be a natural tension between.
Yeah, and it depends on what the acuity of the unit as well. So like ICU units have, you know, much different staffing ratio than say maybe an ortho unit or something like that, where the patients just had hip surgery, but they're not necessarily acutely ill. So that does change, and there are standards across the country that are pretty well established. But one of the things that I've seen personally is I go to different, I've been to different hospitals across the country. Is the hospitals that have the best reputations and have the best, patient feedback, at least to me, about the care that they're getting, have the best staffing ratios with the nurses. And I had a mentor years ago tell me the most important thing in a hospital is the quality of the nursing care. Doctors generally practice standard of care. There's some variance there, but good quality nurses can make all the difference in the care of a patient. And it's not the nurses usually that are influencing that. It's the environment, that it's the culture that the nurses are in. And I was blessed to be part of a very good nursing culture at the hospital I spent most of my time at through my career. And I think that was a reflection of the community. So we have a very good community there, and so a lot of the nurses came from that community. And then also it was a reflection of the leadership. So
Hmm,
of course, culture
what's
reflects leadership.
what's the role the nurse plays with the customer, the patient? Like
It's the most
I don't
important
know enough
role,
about
in my
their
opinion.
job description. What are they actually doing?
So they're implementing almost all of the care. So they're they're the person. So the physicians, aside from some procedures and things like that, are not actually implementing the care. The nurses are giving the medicine. The nurses are turning the patient. They're bathing the patients. They're taking them to the bathroom. They're explaining things to them. Sometimes because the doctor didn't. I try to explain, and you do try to, but then a lot of times it takes more than one explanation. So the nurses go back and kind of reiterate. And so they the absolute front line in that patient's hospital experience and quality of care.
Would you say that okay, so medicine turn be it sounds like there's a relationship that develops.
Oh, absolutely, yeah, for sure.
Like if I hate my nurse, why would I love my hospital?
Not going to happen.
If I love my nurse, it might help me rationalize all the things that didn't go right. That's where my brain goes if I'm thinking about like
Yeah,
that. So
that's
there might
exactly
go
right.
ahead.
No, that's correct because, well, there's two. from my what I've found in my experience, there's three really big influences on a patient's perception of their care and their experience at a hospital. There's their ER experience, which is where most people kind of really focus on. Um, their their interactions with the physicians, which is probably not even as big of a deal. It's not as big a deal as their interactions with the nurses. So because the nurses see them a lot more, they have way more touches. They're with them for 12 hours versus, you know, maybe 10 minutes or so throughout the day. Um, Now that doesn't mean the doctors only spend 10 minutes on a case, but that, maybe that face to face time.
Yep.
And so yeah, the nurse's relationship with that patient is massively impactful. And it's not just impactful on the patient's perception, it's actually impactful on patient care. Because, if and the whole culture together, because so if the nurse has a good relationship with the patient and with the clinicians, that really impacts patient care because a good nurse can recognize, when to contact the doctor, when not to contact the doctor, how to redirect a patient, um, all of those things.
Efficiency.
Efficiency, yes. And all of those things play a huge role. So the nurse is
But hold
really,
on, let me throw something in here.
yeah.
If let's say a good nurse is not on their best day, month, week, or month because seeing more than what's, let's just say, two, for easier words, too many patients for too long. Like, everyone has their limits, right?
Hmm.
What if a good nurse becomes a less good nurse? Could that impact the health of the patient? Meaning, like, oh, maybe they didn't see something, or maybe they weren't as quick, or maybe they didn't
Yes,
communicate something because they missed it, or they decided, forget it because I'm tired, or you see what I'm saying? Could that potentially lower or increase illness, or all
absolutely.
sorts?
Yes. Yeah. So particularly as an inpatient or emergency, any time you're inside the walls of the hospital, the more cognitive demand you place on the clinical staff, nurses and physicians, both, the more likely you are to have bad outcomes. And a bad outcome isn't necessarily a death. It could be just, a missed dose or another day in the hospital or, something like that. Um, Most of the time it's not extremely severe or serious, but that stuff accumulates. If you look at the number of people that are seen every day in hospitals and look at the numbers on a massive scale, then yes, that could definitely lead to, for an even just for an individual though, if you have an overworked healthcare worker, an exhausted healthcare worker, um, your likelihood of having, a prolonged illness or, a mishap or something like that goes up. Now, it's pretty rare for that to happen actually, because there's so many checks and balances in the system. Like every time I order something, it's reviewed by a nurse and a pharmacist has to, there's a lot of checks. There's even the computer system has built in, checks and balances and warnings and pop-ups and stuff like that. So there are a lot. It's pretty rare for like a really big, it's extremely rare, especially like I said, if you look at the huge
Yeah, but I,
numbers.
I got a quote now, came from this podcast. When the hospital is sick, the patients don't heal.
Mm, yeah, that's good.
Because the
Yep.
reason that came up was, what if those checks and balances don't balance because it's just whatever is wrong has been going on for so. I'm thinking about what you said in the beginning. It's like it's too late. It's been too long. Or you know what I'm saying?
So yeah, it can deteriorate to the point where it just things do start the Swiss cheese model, if you will, right? And so those holes start lining up, and so yes, that can happen. I mean, fortunately, I don't think I've ever worked in a place where it has gotten to that place, but I do know of some places that that has happened. And you can kind of, I have friends all over the country that work in hospitals, obviously. And so, you know, there's that can happen. But again, you hope it doesn't. Um, and CMS and the government, there's all kinds of quality measures and things that are looked at. So that stuff
Who
gets
owns
captured.
hospitals?
Well, it's weird. It's some are county owned, some are municipal owned, some are owned by nonprofit organizations,
I
some are
would
owned
hope
by,
that the coolest, most best quality, awesome, saintly people owned those
well,
hospitals. You know what I'm
one of
saying?
yeah. Well, there are some for-profit hospitals, which,
Fine, but they better be loving people.
yeah, you hope so. And I think just like any for-profit business, you you hope that they recognize that what's in their customers' best interest is what is in their best interest, right? So, hopefully they
Well, you
recognize
can't
that.
bill somebody that's dead,
Yeah,
or can
exactly.
you?
No. So I don't want to paint the picture that just because it's a for-profit hospital that you can't have good quality care. I'm sure there are for-profit hospitals that are top quality and do a great job. I'm just saying there are different varying entities that own hospitals. One place I do not think should be involved in healthcare whatsoever is private equity. And you may have some private
So
equity people
interesting
listening to
that
this,
you bring that
but
up.
yeah,
Why?
it's a conflict of interest. It is a from my experience and what I've seen, when private equity gets involved in healthcare, things get worse for everybody. And they may turn a profit for a little bit because they cut costs here and there. They don't understand the complexity of, I don't think, they're looking at it from a strictly dollars and cents like you would a regular business. And there's so many regulations and constraints, and you're dealing with, I mean, people are getting sicker and sicker. And so it just really is not and in fact, if I was a private equity investor, I would not invest in healthcare. It's not, I don't think it's a good investment. And it's probably not a great investment, which is why, they're trying to save here and there, and it ends up being unsuccessful. In fact, one of the largest hospital groups, locums groups, I believe just was bought by private equity fairly recently, and that was that was unsuccessful. But that's because you can't. It's not the airline. It's not a typical business. It's so different, and you're taking care of people and complex, sick people. So that's my opinion. I mean that's how I feel based on, and I keep a, I keep an eye on the industry and how things are going. So I am not somebody that buys and sells hospitals and hospital groups. So I'm probably ignorant compared to those people, but um,
Well, you bring
you
up a
see.
very interesting point because I was thinking about that exact, just coincidentally, when you were mentioning potentially more patients than, let's say, maybe that would be a scenario where someone outside takes control and says, "Hey, we have 3 more hours of work that we
Mhm.
could be," you know what I'm saying? And then mathematically, that could look really, really good. However,
Exactly. That's exactly
what?
what happens. Yeah.
Okay, so that's where my mind went. Just listening earlier, I was thinking,
Mhm. But they don't
I can
realize that.
easily see what their that would be a thing. Like, oh, that looks good on paper.
Mhm. and it
However,
and you can't
that
blame
could
them because
eventually
you can look
go
at
ahead.
that. For instance, say as a hospital medicine doc, I can have a certain number of patients, and I can, every day I go in, I'm like, okay, I have this number of patients. This is how many, if I do this, this, and this, and this. I can see this many patients in an hour. It should be taking me this long to do each note, blah, blah, blah. It never works that way. It never works that way. Why is your doctor always running behind? And when you go to the office, well, it's because there's so much variation. Am I supposed to be like, when a patient is dying and I need to have a talk about hospice to the family that I've never met in the hospital, am I supposed to set a timer for 10 minutes and just be like, "Drink, time's up. I got to go next." No, don't do that. You take it as long as it takes. And so, and you make sure everybody is on the same page, and you make sure that the patient's wishes are being met. And you do that with compassion and empathy. And that isn't something that you can put a number on. You know what I mean? So that's just one example, but there's very, I mean, you have people that get admitted to the hospital that, you start down one path and then things change, and these people are really sick. The people in the United States right now that end up in the hospital are so sick. They have elevated the um they've elevated the criteria to be in the hospital so high
Oh,
that
wow.
everybody in there is super, super sick. Like, we're able to do a lot of stuff as an outpatient, but what that's done is, say 15 years ago or 20 years ago, you may have a percentage of your list that would, I would say a fairly large percentage of your list wouldn't even be in the hospital today, right? They wouldn't even be, quote, sick enough to be in the hospital today. So what does that do? Well, that increases the cognitive demand and uh, the
Wow.
workload per patient, and that's not really measurable. Yes, we have DRGs and we have, you know, uh, level of care, but it doesn't capture the complexity completely. So that, I think, is another big thing that's happening, that a lot of people, unless you're really in it and you're doing that every day and you're seeing that change and you've been doing it for years, you might not even be able to recognize that. But that's a huge factor. And it applies to the nurses and the physicians.
Mm.
So it's just a huge cognitive demand. And so, yeah, you can sit there and try to like divide it up on how long each patient should take, and all this kind of stuff, and efficiency factors and everything like that. But it doesn't necessarily work that way. There is research on, how many critical decisions a human can make in a day before you start having errors. And I think in a lot of times that we've maximized that pretty quickly during the day. So that is the big risk. And then what happens with that financially? So if you want to take it to a financial perspective, well, you have increased length of stay, um, which decreases your financial uh, production, if you will, because every time you have somebody that's in that bed longer than they should be, uh, that's a financial cost, right? So if you're looking at it from a private equity standpoint, um, that's bad. And so quality negatively affects finances, even if it's quality measures that you can't measure. So that definitely is the case. I think the way you described that happens, but it's difficult to quantify. It's very, and even a CEO will tell you, even a CFO probably will tell you, it's challenging to quantify this stuff.
So I have
Which
quote, cutting costs doesn't bring value outside of reallocating capital, reinvesting, and being committed for the long term. Like if we're going to cut costs, it's because it's got to go into something else that's going to bring value
Right.
over
Yes,
a period of
exactly.
time. If
Yeah.
we cut costs, if it just to cut for something external outside of the system, that can benefit a third party, but it won't necessarily come back to the customer, come back to the organization,
Right.
like in very real terms over time.
Yes.
So I think that's me trying to
Yeah, and
conceptualize.
I have the luxury of pontificating as somebody that who's I don't have the decision making, I don't have the burden of leadership of a hospital to make those financial decisions. So I have the luxury of saying, well, I think you should put your people first, and your people will take care of your customers. And that sounds good. And I believe that is true. That is my core belief. But I have the luxury of that not mattering if I believe that or not. Um, I don't have the burden of having to make those hard decisions. So I think that's the position that a lot of leaders are in hospitals now, and a lot of that reflects back to the government and CMS continuing to cut reimbursement to healthcare organizations and healthcare professionals. So that's an easy one because people just in general, the general public is generally unsympathetic to that. So it's an easy one for them to get away with. But what they don't realize is they're eroding the foundation of of our healthcare system when they're doing that, and it will eventually have it's already having consequences. So,
Hmm. In closing, what do we do now? I better not get sick. That's my takeaway.
well, actually, that's a very good point. I mean, preventive health, take care of your health, and make sure that I will say this: if you go into a hospital today, any hospital, you're probably almost certainly going to get the standard of care. If you have a heart attack, things are going to happen that are supposed to happen. These hospitals are very highly scrutinized, highly the medical community is very highly self-policing. Like we go through peer reviews, and you know there is a very high standard for making sure people are getting taken care of, and for monitoring for mistakes and errors and things like that. So I don't want to make you feel like, you should stay away from the hospital, and it's not safe. It is safe, and people get good care. But my concern is that we might be in the buffer zone right now. And I don't know when that's going to end. And I do believe that if there aren't changes made, that buffer will run out and there will be consequences.
If you're listening to this episode, please share this to a friend who needs to hear it and leave a review on the Culture Matters podcast. And we will see you next time on Culture Matters podcast.